Let me officially call the meeting of the Public Health Committee to order. And we have Senate Bill 1 up for discussion. And for today, we have a House member agreeing to present a senator's bill. I don't know about that. We may have to do something about that. But you have the floor.
Thank you, Madam Chairwoman. Chairwoman Cooper is correct, members of the committee. This is Senator Dolezal's bill, but he is right now committed to chairing a transportation committee meeting, and he asked me to come in and I guess be his backup. So I'm going to do the best that I can to move this through, but ultimately Senate Bill 1 is a simple bill. It extends in perpetuity the current law as it relates to COVID-19 vaccination status by removing the current sunset clause, and you'll see that sunset clause on line 40. The current law prevents the government from discriminating against citizens and denying services based on COVID vaccination status. This executive order, which ultimately became law, helped us successfully navigate the worst days of the COVID pandemic and has allowed Georgia to effectively balance public safety and personal responsibility. Madam Chairwoman, that is the effect of the bill. It's removing the sunset, and I'm happy to take any questions.
We do have questions. Senator Al.
Thank you, Representative, for pinch hitting for Senator Dolezal. Tough gig. So I remember this bill when we heard it last year on the Senate side in HHS. At that time, it was called SB 345. And at that time, Senate Republicans included 2 amendments onto the original version of the bill, right? The first version of the amendments you can see in lines 35 through 39, that was introduced by Senator Hufstetler, which basically made sure that, that this bill was in compliance with federal CMS policy. So that's good, because we shouldn't pass things that are against federal law. But the second amendment, which is the one you're talking about, is in line 40. That was proposed by Senator Dr. Dean Burke, who had proposed this sunset provision on the prohibition of this vaccine requirement. Senator Burke, I'm just going to note, is no longer with us in the Senate because he is the Chief Medical Officer at the Department of Community Health, doing a good job there. But his reason for introducing that sunset provision was that it minimized the effect of 345, essentially, because we should not, in government, be in the practice of tying our hands for future pandemic response and taking tools out of our toolbox, even if we aren't using them now or don't think we need to use them now, right? So your bill, I noticed, SB 1, strikes out this sunset provision, as you noted. So my question is, do you think that Dr. Burke was wrong to add that sunset provision?
Well, I think there's a reason why they say doctors practice medicine. And I say that respectfully, Commissioner Burke. And so I think at the end of the day, I don't want to get into the opinion of whether or not Dr. Burke was correct or whether or not he was incorrect, but rather we have the benefit of an additional year. And I think that additional data gives us the perspective that we have seen that the state has successfully run with this law in place. We believe that removing the sunset's the smart thing to do, and we do not believe that it hampers the state from addressing any type of public policy or public safety issues.
One follow-up question with respect to data, just one. Last year, when this bill was introduced, a lot was made of the fact that the COVID vaccines in all their various iterations were newer than some of the other vaccines that we are required to get as we attend school or work in hospitals, this kind of thing. This was said several times. So at this point, 5.5 billion people around the world have received at least one dose of the COVID vaccine, so it's about 72% of the world population. Can you tell me what threshold you would think we would need to reach in order for Georgia to feel comfortable with allowing schools to make that decision, government entities to make that decision to require vaccination as we do for many other disease states?
I think that's a fair question. It's no different than some of the conversations that we had last year about masks, where I went into the well and talked about the removal of the mask requirements. I think that the data that we're seeing is still, at best 24 to 30 months old. We're looking for trend analysis, but I think at the end of the day, what I have seen is that most of that data still does not take into consideration what natural immunity has done, and then what that is going to be able to allow us to be able to accomplish or not accomplish. I don't think I'm going to be able to get into a point and counterpoint with you, Dr. Al. I consider you to be an esteemed colleague of mine, and clearly you have a medical background, but I'm pretty strong on the data, and I feel pretty comfortable in terms of this does not put the state at, I'll say, an adverse position from a public safety perspective.
Thank you for answering those questions. I'm just going to make one more point. Based on the data, is that since we've been having all this rhetoric around the COVID vaccine, specifically what we've seen in this state, and our public health departments would agree, is an erosion in trust in all vaccines overall. And you can see that the rates of childhood vaccination have indeed dropped since the COVID pandemic, and it's not solely related to restrictions on medical care, but again, this erosion of trust overall. So I urge people to consider whether or not this bill that actually isn't really doing very much is worth that erosion of trust and increase in risk to our kids.
Thank you, Dr. Al.
Okay, Representative Chokas.
Me. Thank you, Madam Chair. At the appropriate time, I'd like to move to pass on LC 339304S.
To speak, so hold on to that for a minute.
Yes, ma'am.
Okay, Representative Reese.
Chairman Jones, thank you so much for being here today. I just got a hypothetical for you to help me understand this because I wasn't here last year, so I'm not sure what was debated and what was discussed. But let's take, for instance, the Georgia World Congress Center, which would be covered under the definition of agency right here in this bill as it's written. So if a private entity wanted to have a national conference there and wanted their members to be tested for COVID before they came in, could that entity still require their members to be tested?
Well, I think the bigger question, I think first and foremost, you'd have to look at, Representative Reese, is the Georgia World Congress Center does fall under the definition of agency. I believe, I don't recall underneath agency, and then you'd have to switch to line. My apologies. I know agency starts at 10, but I'm just giving him the sub 14, okay, 14. So it would switch under there, and I would also argue it comes underneath authority potentially in 21 because the Georgia World Congress works underneath an authority. In terms of the state discriminating against an individual, no, they can't do that. But my belief would be if for some reason you and 4 other people were getting together at the Georgia World Congress Center and you as an individual wanted to have that requirement within your private club, well, I would say to you, by all means, have your private meeting, and please do so. But the state could not implement that nor discriminate against you in terms of having that meeting at the World Congress Center.
Okay, that was the clarity I needed. Thank you.
Okay, Representative Drenner.
Thank you, Madam Chair. Mr. Chairman, just a couple questions. First of all, in this preemption bill, does this preempt state government or city governments from implementing a restrictor provision than you have in this bill?
Yeah, to be clear, no, the state nor a subdivision of the state may discriminate against you in terms of services provided. So that could be anything at the state level, from getting you a driver's license, giving you a fishing license at the DNR, or all the way down to the local level if you needed to walk in and get your tax bill. They can't discriminate you and not provide you that service. That's all the bill does.
So my county can still require people to show their vaccine cards if they want to go in and get something out of?
No,
No, they cannot.
they cannot. No, because they're a subdivision of the state, and this is saying that they cannot do that.
One follow-up question, Madam Chair. You mentioned the data that you have. Can you tell us at what point do you suggest that we're at herd immunity?
Representative Drenner, there's a myriad of different debates going on in terms of when we're at herd immunity, when we're not at herd immunity. I've read all kinds of information regarding the Spanish flu of 1918 in terms of when it eventually became effectively what we all just call the flu, even though most of us have inside of us. I'll just say, I'll say influenza and then also the Spanish flu. I don't necessarily see this as whether or not there's herd immunity or not herd immunity. This is a bill about whether or not the state can discriminate against you if you have not taken the COVID vaccine.
Anyone else on the committee? Okay. Representative Chokas. I'll recognize you now.
All right. Madam Chair, I'd like to move Senate Bill 1, LC 339304S, receive the due pass designation.
Do I have okay, I have a due pass and a second. Is there any other discussion from committee members? Okay, seeing none, is there anybody in the audience that would like to speak? We didn't have anybody sign up, but is there anybody that wants to speak? No? All right, then it's time. everyone in the favor of the passage of Senate Bill 1, say aye.
Aye.
Anyone opposed? No. Okay, let's take a hand vote. Everyone in favor, raise your hand. All right. Anyone opposed? 2, 3, 4. Okay, we've got a tie, so I will break the tie and vote yes. So the ayes have it. So that is our only bill for today, and we are adjourned.
Thank you.